Our next topic is all about discharging a patient, the things that you need to consider when a patient leaves your facility. Where to? The patient may discharge to their own home or to another healthcare facility such as rehabilitation center. This normally happens when your patient doesn't have enough strength yet and they need to go to a rehab facility in order to strengthen their muscles and get them ready to go home. To a nursing home, your patient might be too old and couldn't cope up at home anymore, so a patient may be discharged to a nursing home. To a respite care, there might be some tendencies where the family couldn't look after the patient for a short while, so the patient can go to a respite care before coming home. Or a palliative care, your patient may be dying and the family could not cope up looking after your patients because they would be in a lot of pain, a lot of discomfort, and so the patient needs to go to a palliative care. Or a patient may be discharged because of death. What do you need to consider before discharging a patient? You need to consider that your patient is comfortable. You need to assess the level of pain of your patient. You need to make sure that your patient goes home pain-free. You also need to assess the bowels. You have to make sure that the bowels have started to work. Patients in surgical units or surgical wards have pain relief often, and pain relief can cause constipation. We can't let our patients go home when their bowels haven't worked or when their tummy is so constipated or distended. Discharge or order from attending physician. We need to know that only the attending physician can discharge the patient. Before doing any discharge paperworks, we have to make sure that the doctor did order discharge. Nursing discharge summary. This would contain what the nurses did in the hospital and what the nurses wanted the patient to do when he goes home. Medical discharge summary. This is more comprehensive and more complex, and this is the job of the doctor to do. Just an overview. A medical discharge summary contains the patient's details, patient's impression or initial diagnosis, patient's final diagnosis, what is a patient's history, the medical history, if the patient has previous hypertension, diabetes, heart conditions. What did the doctor do and what treatment did the patient undergo? This also includes the medications that the patient did have while in the hospital, and then the medications that the doctor wanted the patients to have when they go home or they discharge to another healthcare facility. This would also include the laboratory results of the patients, so as the X-ray, CT scan, MRI reports. Discharge medications. This would be the medications that the patients bring when they go home. It could either be a discharge script or it could be the medications themselves, and the nurses need to arrange this and make sure that the patients go home with enough medications. Discharge instructions. The nurses need to let the patients know what they need to do, what the patients need to do when it comes to their dressings, or what the patient needs to do when it comes to their fluid intake, bowel motion, what the patients need to consider when it comes to taking their medications, and what are the patient's do's and don'ts, say heavy lifting or driving or heavy activities, or when does the patient be fit to go back to work. We also need to make sure that our patients have their follow-up appointments booked at this stage. We need to also make sure that the patient's vital signs are stable. we can't send the patient where the blood pressure is high or where the blood pressure is too low, and so we can't send a patient when the patient has fever. Transportation arranged. There would be patients where family members would bring them home. However, there are patients who don't have significant others or next of kin, and so nurses need to make sure that the patient is home safely by arranging their own transportation. We also will let the next of kin be aware about the patient's discharge. Other nursing interventions done, such as change of dressings, we need to make sure that the dressings are clean before the patient goes home. And referrals or endorsements if applicable. If the patient is to transfer to another healthcare facility, we have to make sure that we have done an endorsement to the nurses of the transferring facility. In case of death, a death needs to be pronounced by a medical officer. We need to make sure that we record the time of death. We need to make sure that the next of kin is informed about the death. You need to inform your supervisor about the death. Make sure that there is a funeral arrangement made. And post-mortem care, and we need to make the patient look presentable and clean. Remove all attachments like IV fluids, IV cannulas, indwelling catheters, chest tubes, etc. If it's a medico-legal case, we need to wait for the investigators to perform their task before touching the patient. Please remember, do not touch a patient and do not perform post-mortem care if it's a medico-legal case. And transport to morgue. And finally, you need to complete your paperwork or documentation. There are a few issues that we need to consider when it comes to discharging a patient. There are patients who goes home without next of kin, and as mentioned previously, we need to make sure that the patient is safe to go home. That's why we need to arrange transportation. And we need to make sure if the patient can cope at home. If they can't cope at home, we might consider another discharge venture. Community service arranged. If there would be dressings done secondarily, does a community nurse know? There are patients who wants to go home even if the doctor does not allow them to, and this is called home against medical advice. Patient needs to sign a waiver or a home against medical advice form, and nurses needs to explain the pros and cons of discharging against medical advice. If the patient still wishes to go, in spite of the nurses explaining them, it is the patient's right to go home against medical advice. However, we need to make sure that they sign a waiver or the home against medical advice form.